You're watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. Today's topic, extreme smile makeovers. According to my first guest, he says if you don't like your teeth and gums, you're never too far gone to have the smile you've always wanted. We've had him on the program before. He's from Nashville, Tennessee, Dr. Kent White. Dr. White, welcome to the program.
Hey, good morning, Randy. How are you?
Good. Now, I mentioned from Nashville, Tennessee, but you now have this one of the big centers now in Oceanside, California, where you pretty much just about do everything. So for people that don't know your practice, who's the typical patient you see?
Well, first of all, I'm just so happy to be here,
Okay.
and I just love living here.
Okay.
And but our typical patient, I would say, really two different groups.
Okay.
We have one group that comes in and they have dentures, or they have basically already lost their teeth, and they just want, they want something that they can chew with. They want something they can look good with, and
Okay.
things like that. And so for those people, what we do is we put teeth in that you don't have to take out,
Okay.
that are supported by implants.
All right.
They can chew with and eat with.
All right.
And our second group of people that we see are people just not ready to lose their teeth. They've been told maybe all these different options, but they just don't want to lose them. And they're tired of also having to go to the dentist all the time.
Okay.
Yeah, and the last one is more of a medical-based group, but you might hear the words TMJ or head and neck pain, but they're basically people to where something's going on with their bite, where the kind of teeth fit,
Okay.
or their jaw position. And the other group, which is mixed in really with all of them, really, is the cosmetic or the aesthetic group, or the people that just want their teeth to look really good and really white and just beautiful.
Okay. We should mention before we get started that you trained at the Las Vegas Institute and were a clinical instructor. What did you teach there? And by the way, people need to know, I guess, what Juilliard is to music, that LVI, the Las Vegas Institute, I guess is like where the best of the best all over the world go to learn.
That's correct.
Cosmetic dentistry, learn to take care of TMJ problems, snoring, sleep apnea, cosmetic dentistry, dental implants, and all those things. So what did you teach there?
Well, you kind of already took it away from me.
Okay, sorry about that.
But I should ask you. No, you're exactly right. It's Reconstruction dentistry, cosmetic dentistry. They're all really interconnected, and it truly is the best of the best.
Okay, good.
And I did that for about 10 years while running the practice.
Okay.
So very privileged.
Now, today's topic is this, as dentists call it, full mouth rehab, or as you call it, full mouth reconstruction. Give us a working definition of what that means for the sake of this show.
Okay, well, that basically means people are not quite ready to lose their teeth and probably don't need to lose them. And it's basically keeping the teeth that they have and not being in that merry-go-round of having a tooth of the year or some of these other things. But it's fixing, aligning the teeth, and keeping them where they can chew and eat and look good. And that may include some of the newer cosmetic crowns. It may include implants. It's a combination of processes. It's where we look at the person and under one roof, able to do that just myself.
I had an oral surgeon. He's well known in the industry. Dr. Picos, as a matter of fact. He said, Randy, there's this new breed of general dentist. He goes, it's not a recognized specialty by the Dental Association, but they're super specialists. They learn to do root canals. They learn to do wisdom teeth. They learn to do dental implants, cosmetic dentistry. Does that describe you? Like at your center? You're kind of doing everything right there?
Absolutely. It's just what I do. It's what I love. So what they really like is they like that our center is able to do everything right there. They don't want to go to 2 or 3 other visits or other people, I should say. And we just do it all right there.
Good.
We have a great team. When we moved here to San Diego, we scoured the area to find the best of the best.
Good for you.
And we know what that looks like.
All right. We said at the beginning of the show that your teeth and your gums are never too far gone or too bad to have the smile you've always wanted. Is that a bit of an overstatement? Could your teeth be too bad to have a great smile?
Your teeth could never be too bad that we can't, through a combination of different procedures, make them excellent.
Okay.
It's a really important thing. It's just never too far gone.
Good.
We can always help.
So you brought some photos. What are we looking at?
I did.
And these are all what? Full mouth reconstructions, as you call them?
They are.
Okay.
They are. Well, this first guy, I don't know. he just blew us all away because he's just such a gentle person. And I remember when his daughter came in with him, and the bottom line is he didn't want to lose his teeth. And he was in pain, we started finding out, and he was embarrassed. He was not wanting to go out. He'd kind of started changing his eating habits. So this guy couldn't eat the meat, the vegetables. He basically let his teeth decide what he was going to eat instead of his brain, as we say it.
Okay,
Yeah.
okay.
So what I saw was, I mean, he had some bad breath, missing teeth, teeth malaligned, and all different colors of teeth. But all I kept thinking about was what we're going to do for him afterwards.
Okay.
And that's what I see. I have to be careful because I see the end result, and it can sound almost a little salesy because
Like you get a little bit excited.
I get off the chain excited. I mean,
Okay.
yeah.
Looks nice.
Yeah, well, thank you. But the thing that really just blew me away about him is just he comes in literally on the second visit telling us, you know, I'm eating apples now. I'm eating not just corn on the cob. For some reason, I think he didn't even like corn on the cob.
Okay.
But
Just chewy foods. He can
chewy foods, barbecue, things that he could not normally chew on. Nuts. He had not eaten nuts. I don't know. I think he told me 6-7 years.
Okay.
And but the thing that really just blew our team away is just how much he's smiling and how happy he looks. I mean, this is a father. This is a grandfather. This is a man who had kind of secluded himself home.
all because of his teeth.
I think so. I mean, that's what others tell me, and that's what I'm seeing from him. Now, I have the liberty of him coming back a few visits, and I start telling stories. He's bringing other people with him, and but you know, the other thing too is, you know, people had also told him he was too old, or you know, I mean, that's just what they say.
You say they all have regrets. What do you mean by that?
Yeah. Number one, regret, and number two, I wish I'd have done it earlier.
Okay.
Yeah.
Because nobody likes going to the dentist. Do you still hear that? Like, no offense, Dr. White, but
That's exact. I hear it all the time.
do you have any kind of a funny response after all these years?
Well, usually they'll say, you know, no offense, I hate dentists. And I'm like, oh, absolutely none taken. I hate patients. And
We do make some few wisecracks like that because I know you have a sense of humor.
it's hard not to say that joke. I'm conditioned to it. And,
Okay, that's funny.
And that's so
Do they
far-
chuckle over that?
They do. But, you know, what's funny about it is they not only chuckle, then they pull their chuckle back like, I am so sorry. Let me share this next one with
All
you.
right.
I mean, I know it may not look like it, but we, short of tickling, we literally had to do that to get her to get the smile. And she came in, just teeth all over the place, and she was just telling us how embarrassed she was. I'm smiling really big here because I know what ended up happening, and wow. And the other thing too is just to get her to smile this big. I mean, we were close to hiring a tickling team because we need
Okay.
we need to be able to see the teeth, and we also want her to see what she's seeing and others are seeing. And she was ashamed of them. I mean, her teeth were hurting, her gums were hurting. So what she really wanted, she just didn't want to lose her teeth.
Okay.
And what we're able to do, and she didn't want a denture.
Okay.
She, you know, just not going to have a denture. So we were able to take care of all that. We first got to get in there, get some of the infection, clear up the gums, and see what we're dealing with. And so look at the before and after there, Randy. I mean, would you say
It's a big difference.
It really is. You know, but we got her what she wanted. You know, she wants to look good. She wants to feel good. She wants to be able to eat what she wants, and she has teeth that she doesn't have to take in and out. So that's a home run. But most importantly, she is happy. You know, and yeah. Would you say between her before and after,
Yeah.
she looks more attractive?
I would say she looks more attractive for sure.
Well, that's not just you. I mean, that's everyone. It makes everyone look more attractive.
Okay.
It's not
Teeth.
just her. Absolutely. I mean, you're smiling. How you're feeling about yourself. It's huge.
You say people will perceive her differently. Tell me about that.
Absolutely. The perception is, I mean, if you think back, it's not just me saying it. I mean, think of all the studies or even shows that you look when you're watching a lot of these movies. I mean, our villains are often with the crooked teeth or the dark teeth or things of that nature. I mean, you know, even when you approach someone, and I've been in a few countries, this actually happened to me not too long ago in a surgery course. I was, you know, I'm looking for some help, and who am I going to, especially if non-English speaking, who am I going to? Someone that's smiling, someone that's kind of laughing, someone that looks happier. So it's not just, you know, it's bigger than perception. It's, you know, and that person helped me.
So she will smile more now.
She would smile like crazy. Well, let me tell you what actually happened. I mean, people were talking about her. They were talking about how grumpy she was. And they were also saying, you know, she never smiles. And not only is she smiling all the time, now this is according to her and her friends and her mother that's come in. She is now working as a nurse, traveling nurse.
Okay.
And so she went back out there. You know, it revitalized her. I mean,
so the self-confidence is back.
The self-confidence, and I mean that to me is what she got from this, and that's what I see in a lot of others. So she's eating what she wants to eat. You know, she can eat the salad, she can eat the steaks, she can eat, in the South, we're corn on the cob eaters.
Okay.
You know, and that's really important. And she can get her diet back where she said she wanted it to be. And that's powerful.
You say when it's all done, they get their full mouth reconstruction, that they come back, they act differently.
Yeah. I mean, they're different people. I mean, this person especially, she brought in her mother, she brought in a couple of friends. We did a big gag with the front office with a couple of her friends. We don't have enough time for that show, but it was major funny.
Okay.
And but you know, she doesn't have to tell us anything. We're seeing it in her.
Okay.
Just the way she's presenting herself and how happy she is.
What's it like when they look at the mirror for the first time?
Besides the tears of joy, I mean, it's almost 100% tears of joy. It can almost be like they've seen a ghost, but in a good way. I mean, they're visiting someone that I think, here's what I think, and now others have kind of corroborated the story. I think they're seeing the person they had always hoped or wished was there.
By the way, if I didn't know this person, like you're showing the show, doesn't look like the same person. That's without exaggeration. Anybody looking at this would agree.
I agree.
Because, you know, going into this, and I told you, it's just teeth. And you said, Randy, you were going to strangle me, I think, in the green room. It's more than just teeth.
Correct.
You said.
Yeah. I mean, it is.
Good for you.
It is. Let me show you another case.
Right.
This is a case. Well, he's a dentist, and he chose us to help him. And, you know, he came in because I just don't like the way my teeth fit. And, you know, it's just time to do something. So, in just a couple of visits, a couple combination procedures, we were able to keep all of his teeth, and
that's nice.
And you can see here on the after, the thing that you know, we got him exactly where he wanted to be, and then here is what the thing is that I hear from him and his wife was who kind of the objection person here. He loved the way they looked. He said, "I love the way I look."
So he went into it with the eating and all that stuff, and then he ended up liking the cosmetic part of it.
Yeah, just got tired of a tooth every now and then breaking or needing a root canal or all the things that I often hear from other people. You know, every time I go, something's wrong, which is why, really, going back to the beginning of the show, that I got into the reconstruction and got into the training to do it, is I wanted to completely fix and help heal these people. And
but by the way, I don't want to put words in your mouth, but I think we've talked on the phone. You said, it's kind of paraphrasing, but it's fun for you to take somebody where their mouth is falling apart, broken down, bad gums, and then give them this beautiful smile. You said that's more fun for you than just doing like these all-on-4 dental implants where you just put in teeth, and that you like the challenging cases. Is that true?
Yes, you're a pretty good listener, Randy. I like it. I mean, I actually love it. I mean, think about it. You take some of these people that's lost all their hope in their teeth and things, and now we have them back to where something, they love what they look like, they love that they can chew, and they don't have to come and visit us, you know, all the time. That's a cool thing. That's a cool thing. So this lady came to us very much like the others. but didn't want to lose her teeth, and had been to other places, and according to her, she just did not want to lose her teeth. She didn't feel she was ready. Complex case, a lot of work.
Okay.
Missing teeth. So with a combination of procedures, we're able to actually get her exactly where she wanted to be. Get the spaces taken care of. Get that big, full, broad smile. Get her lips out. Get her face smiling, not just the teeth. And that's one of the first things that she told me. She said, I'm going to have to learn how to smile. That's not a joke. Good. When you look at the before and after here, would you say she looks younger?
She looks a little younger, that's for sure.
Would you say she looks a little happier?
Yes.
Yeah.
And healthier. She looks healthier.
Yeah. She and this was a big deal for her. So now she can eat what she wants. She loves smiling. She's going out places that she said she hasn't been in years, which could get expensive. Going out to eat. That's expensive. And people always come back to me, well, dentistry is expensive. I said, no, poorly done and dentistry done over and over and over, that's expensive.
Now, you were a clinical instructor at that Las Vegas Institute. You were teaching dentists. Look, I'm trying not to exaggerate. You were teaching dentists from all over the world how to do these complex rebuilding mouths. Does it cost more to go to a guy like you?
No, it actually saves money. Because you get it done right the first time.
Well, good for you. Okay, good. We have time for a few more photos.
Okay. Glenda, she's just amazing person. So she just didn't like her front teeth. She didn't like that forward movement. And she went to other places, and they recommended orthognathic surgery and braces because of the way the jaw and the teeth didn't meet.
What do you mean orthognathic surgery?
Yeah, orthognathic surgery is basically where they break the jaw and reposition it. It could be done with the lower, it could be done with the upper.
Okay.
And that was just an option she just
So
didn't
when you
want to go
saw
through.
her, why were you able to do it without breaking the jaw?
Well, I knew after we took some measurements and got the muscles in the right place, I knew we could get her exactly where we wanted her.
Okay.
Yeah, this is right up my alley. This is what I do. This is what I've been trained on. And it's an option that a lot of people can have. It'd be an option to surgery.
Okay.
Yeah, and braces for a lot of the cases. So we were able to rebuild the teeth, put the teeth in the right place, using some of the cosmetic porcelain. Now I want you to look at this after.
Okay.
Look at how the teeth perfectly fit her face. Look how her eyes are lighting up.
That's a good point. That's a good point.
Look how they're following that lower lip.
Looks like a young smile, actually.
She put her hand there. It was like this is her husband telling me this.
Okay.
He sells seed. I've never met a seed salesman. So,
okay.
But he said she sits in the mirror, spends all this time now, and she's just a better person to just hang out with. And she's to us, we loved her anyway, but that's when it's sealed to me, is when the husband or the spouse comes up and just say, they're just as happy for her.
That's good. That's good.
That's a good thing. Okay?
So why would somebody in their 80s or even 100 years old want to do this?
Well, they want to eat and chew.
Okay, that's fair.
And they still want to look good too. I had a 102-year-old come in.
Really?
Oh yeah. And actually, his friend was 104, so we were very excited. It helped our whole data. But we asked him, why are you doing this? And he said, well, son, I want to look good in my casket. So, by the way, I want to mention on that 102-year-old, we did a few implants, combination procedure, and beautiful smile. So you're never too old. It's just not.
So it doesn't matter. Now, you had to be a little nervous working on a 102-year-old.
I don't think I've ever been posed with that question, but I wasn't. I wasn't.
Like in your mind, you just had what? The end result? In your mind, you're going...
I truly do. I truly do. And maybe, I figured if he's made it to 102, he's going to make it to 103, and it's not going to be that day.
Okay, good. I talked to your wife on the phone because she used to run your practice in Nashville.
Correct.
And she said, with her southern accent, but she was saying, I want people to know that Nashville's best cosmetic dentist, implant dentist, full mouth reconstruction guy, TMJ guy is right here in Oceanside. and we're putting together a dream center. I said, well, I'll try to get that in if we can. Okay. So that was nice that she supports you and believes in you.
Yeah.
But we have time for a few more, so I'm going to rush you.
Okay.
On these.
Okay.
And these are all full mouth reconstruction.
These are all reconstruction case. But she came in, didn't like the way they looked. Actually, she didn't like the gold showing. Okay. She had a few missing teeth and some old dentistry. And
was she thinking she was like maybe going to end up in like a denture? Or no?
She didn't think she was going to end up necessarily in a denture. But I think the thing that I see the most, Randy, is as people start getting older, others start telling them they should save their money or not put it in themselves. I mean, that's the thing that I see. And then that's what they tell me. Okay. So I'm not coming up with it. And it saddens me because when I look at what we did for her afterwards, I mean, just, get her bite together, basically to get the empty teeth filled in, put a couple implants in, and get all of that done really well and quickly. And to get over to an after like we have, I think the picture, well,
she looks great.
Yeah, and that's fantastic. So let's look at some more.
All right.
And this one, she's a school teacher. I see all walks of life, all different types, and she didn't like because the teeth weren't in the center. She didn't like the way her teeth fit together. She didn't like the fact that she had to go to the dentist all the time, and she was struggling. She happened to love pistachios. I know you have some things. I
like pistachios.
Okay.
Yeah.
There. So maybe I can call her for you. But the other thing is, she was holding back, not wanting, afraid to let herself have a beautiful smile because she was thinking cosmetic dentistry cost more, but it doesn't really cost any more to make teeth look like teeth and then just put them together in the right place. And so you can see here in the after.
Very nice.
Combination thing. These are short visits because we worked on this, streamlined it to get it exacting, from the beginning. So here's a guy, he came in, hated the way he looked, embarrassed to smile, couldn't chew, teeth loose, the bad breath. So what I saw really was the end result. This is a home run. I can see the finish. Okay. But it's a complex case. There's a lot going on here. And so with the combination procedure, he's in the right place. This is our thing. You can see by the after. I want you to look. What do you see in terms of his face, his teeth, the smile?
He looks like a different guy.
Yeah.
Is that the same guy?
It's the same person.
Anybody watching this would agree.
Yeah. Mm-hmm.
He looks much younger.
Yeah. He's like Mary from earlier. Every time he comes in now, he brings one or two extra people. And they're not necessarily doing dentistry or anything like that, but we just kind of notice, why is he doing that? I can tell you my opinion.
What is it?
But I go out there and talk to them in the little reception area. They tell me his story. They tell me how much happier, how much more confident he is, how much...
He's definitely more handsome in that after.
He is.
That's just teeth?
Yeah.
Because he looks much younger.
It doesn't look like teeth.
Looks like it could be the younger brother or even the son of the before.
Yeah. So you keep asking me this question, is teeth that important? If we had never had this conversation, you never thought about that, and you just looked at these two pictures.
Yeah.
Let me ask you. Is teeth...
Yeah, it does. It's a dramatic difference.
That's the only difference here. Now, for the really critical eye, you would notice there is a mustache on the before.
Yeah.
Why did he have that mustache? His mom told me. And this is a strong construction engineer kind of fella. They grow these mustaches and beards often, from what others tell me, is to hide the absence of teeth or the presence of crooked teeth. But now, when he looks in the mirror, what you see is that's charisma. That's him loving what he's seeing, and he wasn't like that before.
We are short on time, and I know you got, so we probably have a minute and a half left.
Okay, let's do it.
Okay.
So this guy comes in, and I'm smiling because I already see what's going to happen.
Okay.
He's going to love it.
All right.
And his teeth are flat. He's young. They're worn down. He's visiting the dentist constantly for issues. So I knew we could help him. And,
so what'd you do?
So we put the teeth, got the jaw, everything back in the right place. Used these ceramic type porcelain crowns.
Okay.
And rebuilt him in the ideal place.
He looks good in the after.
Yeah, I mean, he's just
he's
a different person.
We had a short discussion in the green room. You said that you have no crystal ball. I'm paraphrasing slightly.
Yeah.
But this guy's life may end up in a different direction because of his self-confidence.
You know, Randy, in life, if you don't like something about it yourself, I mean, it holds you back.
Okay, that's fair.
And this was holding him back. And
now it's behind him.
Now it's behind him. Let me show you this last one.
All right.
Okay. So this case basically is a fixed case. He had lost tooth, had a big front space, and the other dentist, orthodontist, had moved the teeth to close them. And he just didn't like the way they looked. So this is a tough case, but we were able to take ceramic crowns, put the teeth together, and make them proportion. So basically make them look beautiful the way they should be.
Looks good.
And yeah, it's just, and he is ecstatic, has also formed a new company. I mean, things that, we've been talking about throughout the show, but it's just been powerful how these guys go.
Okay, full mouth reconstruction. Somebody watching this, really bad teeth and gums. They don't want all their teeth removed.
Right.
But they're afraid for whatever reason. Mm-hmm. What do you say to them? They hate their teeth. They hate their smile. Yeah. Can't chew and eat. Yeah. They're in a lot of pain.
Yeah. Well, call us. I mean, that's the first thing you have to do. Believe in you can be helped. There's nobody that's beyond that. And take a chance. Take a chance on yourself, because this is really about them. It's about you.
You say you don't change their lives. They do, by picking up that call, getting it started, getting the momentum, going to the dentist.
I can't stand that. The bottom line, it's the people watching. It's the people that we see. Those are the lives that are getting changed. I'm just facilitating. I'm just
okay. Good.
Just
good
helping.
for you. Good for you.
But,
Dr. White, I want to thank you for coming on the show. Good stuff. You've been watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. For now, I wish you good health.
Thanks for watching the Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.